cancer do not give you any sign. It's a very silent and without even give you any pain or anything. So now, for example, like this is a very interesting phenomenon that if someone has a heart attack, then maybe he gets a stent or any heart surgery that maybe using any like ring or doing any other kind of heart surgery. At least with the device installed in the heart or in the artery, they can still live for quite some times with the device. But cancer, when somebody diagnosed with the cancer, they are going to feel like a horror because they have to go through to the devastating therapies. They have to get the therapies like radiotherapies or maybe like uh, chemotherapies. So all this process, it will really disturbing their quality of life. For example, anybody who have cancer, when they go for the chemotherapy is when they get injected by big amount of chemical or medicine into their bloodstream. So this chemical, the intention is to kill the cancer cell, but in fact, this chemical will not only kill the cancer cell, but this chemical, this medicine will kill the healthy cells. So we can see people or patients with this cancer, which they are doing the chemotherapy, they will feel very disturbing life. They will lose their hair. They will feel very weakness. They cannot eat food. They feel like every time they want to eat food, they like to feel vomiting. So somehow even cancer will kill. Cancer will kill slowly because by stages, stage one, stage two, stage three, stage four, then definitely cancer, when it's already spread to the whole body, the cancer cell will conquer the healthy cells. Okay, we go to the next slide. Now let us see uh, cancer cell how they grow. Cancer cell how they grow, it's remain unpredictable, and in some case it's mysterious. Uh, Even some after seemingly effective treatments, cancer cells are able to hide. Cancer cells are able to hide in some patient organs. The cells still can hide, and later after the treatment, it can still coming out again or resurface. So cancer can start anywhere. Cancer can start anywhere in our body, which is our body is made up with trillions of cells. So normally human cells grow and divide to form new cells as the body needs them. Then when the cells grow old or become damaged, they die and new cells take their place. So this is the cycle of the body cells. Now, when the cancer develops, however, this orderly process breaks down as cells become abnormal. So the healthy cells, uh, there is a mechanism inside the cells become abnormal, and then which is when the cell is supposed to die, uh, but because of these cells transform to be an abnormal cells, then these abnormal cells will start to invade the other healthy cells and will start to develop, will start to grow, divide themselves to become a cancer cell. So it is very difficult to tackle this cancer. Now, next slide, please. Now we all know that cancer, cancer is cancer kills, and there is still no cure for this disease. So cancer kills for four reasons. Cancer cells, they don't die until they kill you. Cancer cells, they don't die until they kill you. The second thing is they form tumors, which make your organs malfunctioning. For example, it starts, for example, in your lungs. Then when this cancer start or in the breast, for example, like in the breast or in the liver. So it start with a tumor, and then it start to grow and start to disturbing the function of the organs. Okay, and then cancer cells will hijack the blood vessel to keep them alive, and cancer cell will travel to other parts of the body to cause further damage. Okay? So sometimes cancer cells break away from the original tumor and then travel to other areas of the body where they keep growing and can go to form a new tumors in other organs. So this how cancer is spreading. The spread of a tumor to a new place in the body is called metastasis. Now, let us see. Actually, the problem is we have to be able uh, to do early observation of any sign or symptoms of certain cancer. Okay, so for example, when you observe there is a change in your bowel, for instance, the shape of the stool becomes small or become thinner, especially when we can see the stool coming out with the blood. So it is possible when the size of the stool is become smaller or become thinner and come with the blood, it is very possible that we have the colon cancer. Colon cancer. Now, another thing that if we observe hematuria and then it doesn't give you pain, this is the warning of bladder cancer. Or maybe on the skin, when you can see there are sores, sores that it's do not heal. Okay, do not heal. No matter what you do, medication, it's difficult to heal. So this is the sign of the cancer, skin cancer. And like in your mouth, when there is white patches inside the mouth, or white spot on the tongue, this is possibly oral cancer. Then unusual vaginal bleeding or discharge. You know, when the women, when they have their menstruation, maybe it will last 5, 6, 7 days. After that, finish menstruation. But there are some cases, somehow like the menstruation is cannot stop. It just keep come with the blood, keep bleeding. So this is like an unusual bleeding. I have received one message that there is a lady in South Africa. The patient, a lady patient, is already have this bleeding since July, August, September. Now it's almost 3 months. The bleeding is not stopped. So this is the possible of any sign of cancer, maybe cervical cancer. So next slide, please. And then thickening or lump in the breast. So if you try to make your own observation in your breast, if you found that there is a thickening part or maybe there is a lump, sometimes it's painful, sometimes it's not showing any pain. So this possibly as a tumor, and later these lumps, it can grow to become a cancer, to become a breast cancer. And then for some people who have indigestion or trouble swallowing, if you have trouble swallowing, this is also a sign of having a stomach or esophageal cancer. And then the recent change in wart or mole of any new skin change, we can have this skin cancer or melanoma. And then when somebody has this coughing, nagging cough, and then hoarseness, somehow like a pressure in your chest, in your lung, not in your heart, but in the right and left chest. This is possibly the sign that you may have lung cancer. So actually, we have to do earlier observation when you find out there is something wrong in your body that it's never happened before. Because if we can catch this early observation, then we can go to the doctor and to find out is there really a problem, possibly a cancer in our body. Because if we can find out in earlier stage, the cancer still can be managed. But when the cancer is already in the third stage or maybe fourth stage, it's a bit more difficult. You may need a lot of treatment like radiotherapy or maybe chemotherapy. And even you go with this therapy, it won't guarantee you you can get healed from this cancer, because once the cancer enter to the fourth stage, the cancer will start to spread to other body through the blood circulation. This is called metastasis. Okay, so we can go next. Now, don't wait to feel pain. Cancer in earlier states usually does not cause pain. Okay, so what causes cancer? What causes cancer? First, maybe genetic factors. It's possible genetic factors inherited from our parents. Okay, and then second is lifestyle factors like smoking, tobacco use, or maybe uh, diet or physical inactivity, and then certain type of infection like some viruses linked to certain cancer. Like, for example, the hepatitis B or hepatitis C virus. This can develop to become a cancer in our liver. And then HPV virus or human papilloma virus, this is the culprit of this cervical cancer. So viruses also can become one of the causes of the cancer. And then next is environmental exposure to different types of chemicals and radiation. So be careful when you are using your mobile phone. I don't know, in South Africa or in other country, do you have a green world what do you call it, anti-radiation patch, like a gold patch you stick on your phone. This is to reduce the radiation from your phone. This is a very good product actually. So especially right now when the network has already developed to 4G, even now 5G is coming. So the possibility to get radiation from this frequency is we have a very high risk, especially to our brain. Many people, when I was in Canada, there are 2, 3 people coming to the office, and they say that they get diagnosed with brain tumor or brain cancer because very simple thing, every day they have to use a Bluetooth device when they are working. Some of them working as a driver, truck driver. So they are using the Bluetooth device in their ear, and they have to be connected with the headquarters to keep communicate to get the direction where they have to go, where they have to stop. So they keep using, at least in one day, using this Bluetooth earphone for 6 to 8 hours in a day. And then less than 1 year after doing this, then they get diagnosed with the brain cancer or brain tumor. So this is the reality. Don't play with this. Yes, it is cool that we have a Bluetooth device hanging in our ear, but be careful with this because it causes huge radiation to our brain. And then next is age. When we are getting older, uh, it is likely that we can develop a cancer because due to buildup of damage of the cells in the body. And also maybe when we are getting older, when we are not taking care or we are not taking any supplements to maintain our immune system, this can also we can get attacked from free radicals or from viruses, that even this can cause inner cancer also. Then immune system, the compromised immune system have an increased risk of developing certain cancer, like people with HIV or people with immunosuppressive treatment. Okay, they can also have risk to get cancer. Next. So now let us see what are the treatment, the cancer treatment that people are doing when they get diagnosed with the cancer. First is surgery. Remove the cancer from your body. For example, if any ladies they get breast cancer, before the cancer starts spreading to other organs, doctor will decide to remove the breast. And many of these breast cancer patients, once they move, for example, the left breast with the cancer, after 4 to 5 months, another cancer start growing in the right breast. So many cases like this. So that's why, as I previously said, that cancer cells, they can hide somewhere, even though the doctors maybe already do the surgery, but it doesn't mean that we already free from the cancer. Second thing is radiation therapy, radiotherapy. So we are going to enter to a machine. This machine will generate a high radiation to shoot direct to the cancer. For example, like if the breast cancer, the radiation will be shoot directly to the breast cancer. So unfortunately, this radiation therapy, it will not only kill the cancer cell, it will also kill the healthy cells. And the side effect is definitely the patient will feel totally losing their energy. Even they even cannot sit down, not cannot stand up, and then they will feel a lot of pain. Somehow, like the sensation is like a burning sensation, like their organ is being burned by this radiation. And then skin changes, hair losses, vomiting, diarrhea, indigestion. These are all these side effects of the radiation therapy. And then the last thing is chemotherapy. Okay, can you hear my voice? Okay, so the chemotherapy is use drugs. The doctor will give an injection of the high amount of chemical to kill the cancer cells. Unfortunately, again, this chemical will kill
Okay, have we lost him? We can't hear you, Mr. Budiman.
Okay, now. Okay.
Yeah, you're back.
Okay, the side effect of this chemotherapy is like a fatigue and then hair loss and then the easy bruising or bleeding, infection, and then anemia or low red blood cells, because somehow this chemical will destroy the red blood cells, even the white blood cells also. And the patient will experience vomiting. Okay. So this kind of side effect is terrible if we already started to get, and when people start taking this chemotherapy, it's not only one time. They have packages somehow, like you have to take 5 times or 7 times. Some people even more than 10 times of chemotherapies. It depends on the cancer, type of cancer, and how worse the cancer is. So in this process, even the medication itself, it will kill the patient. because of too much chemical enter to the system. Next, please. So now let's see, we have some products that can help to prevent the cancer. Now the products are, first is grape seed extract, or OPC. So it has a powerful antioxidant that fights against the free radicals. So the free radicals is the culprits of the oxidative stress to the body cells. So when the cells get oxidative stress, the cell will get damaged, the cell will become abnormal. This is the beginning, the starting point when the healthy cell will transform into cancer cell. So by taking antioxidant quite a lot to our body, not only grape seed, also like blueberry juice or any blueberry series, blueberry products, okay, these are rich in the antioxidant. This will help to protect our body from the free radicals. The next, blueberry juice also contain a high vitamin C, because the ingredients of the blueberry juice is blueberry, blackberry, raspberry, and cherry. So it's also rich in vitamin C, minerals, and anthocyanins. Anthocyanins is the antioxidant. This anthocyanins is one of the most powerful antioxidant that can effectively fight against the free radicals. And then we also have lycopene soft gel, or maybe if we don't have lycopene soft gel, we have beta carotene and lycopene capsule. Beta carotene and lycopene capsule, this is the same thing. Okay, so lycopene is part of carotenoid family, a natural antioxidant that fight against the free radicals. And next, we have intestine cleansing tea, or milk cellulose, or dietary fiber, or probiotics, or blueberry enzyme, or this clear chang ching ching. Okay, so these products is working in our digestive system. It cleans the system, our digestive system, cleans the intestine, cleans the colon. It will improve the healthy bowel movement, and then shorten the colon transit time, and then reducing the risk for colon cancer. Now let us see how to prevent cancer. We can go to the next slide. So how to prevent cancer? There are many things that we can do to prevent cancer, like keep the phone away from your head. Okay, if you want to use the earphone, use the one with the wire. Try to avoid the use earphone with the wireless. Or now is trending is everybody is using, anybody who is using iPhone, they will use the iPod. Okay, somehow like this is a lifestyle trending, but actually for your health this is not good. And then eat clean food. You know, in Africa somehow the farm production, the food production, we have to be very careful, because the farmers, they are spraying insecticide, they are spraying pesticide, and they are also using chemical fertilizer. So these all chemical substance will increase the chemical residue in the vegetables, in the fruits that we are buying from them, we are buying in the market. And when we eat these vegetables, we just wash, rinse with water, nothing else. The good thing is, I don't know, in Africa, do you have ozone machine, greenwood ozone machine? This is a very good machine that one of the way to cleanse the vegetables, the fruits, or even the meat, chicken or beef, before you start processing, before you start cooking this food. Try to use this ozone machine, clean the chemical substance, clean any bacteria or virus. So ozone will eliminate everything. So try to utilize this ozone machine. This is a very good device. So you can imagine, if every single house, if we tell them about this importance of using the ozone machine, So how many house will need this ozone machine? This is your market. This is how you are going to sell this ozone machine for every house. So you get a lot of BV also. Okay. So then drink plenty of water. Drink plenty of water, and then switch our food, like we used to eat rice, spaghetti, or maybe bread, white bread. So these food with the gluten and too much sugar level, somehow if we are trying to exchange this food, or we combine these carbohydrates with the whole grains food, and then we eat more vegetables, we eat more fruits, this is will help to prevent our body cells to get cancer. And then also um, let me show you one thing. When you do a barbecue, I think South Africa, I see your food, you have a lot of barbecue meat. Am I right? Okay, when you do grilled or barbecue, it can contain the cancer-causing heterocyclic amines, which is this is coming from the polycyclic aromatic hydrocarbons, which is when we are doing the grill or we are doing the barbecue using charcoal broil. So when we just grill the meat like that without marinate the meat, this will somehow like make the outer layer of the meats become black color, and this burning layer, when we eat this can increase the risk of us of getting cancer. So try to marinate the meat before grilling, and then load up on green greens. What does it mean? When we are eating salads, okay, you know, salads, you can put tomato, you can put spinach, you can put kale, you can put what else, corn, and then with the dressing, any kind of dressing, Italian dressing. So try to select the dark green leaves for your salad. Dark green leaves, the dark green leaves, it has more powerful for in our body, so to prevent the cancer. So dark green leaves is much better than the light green leaves. Okay, and then do exercise, try to do exercise on daily basis. Walking is the simplest thing, like for every day, if you can start walking 15, 20, 30 minutes, okay, this is a good thing to prevent our body to get the cancer. And then for ladies, please do regular checking on your breasts, uh, because this is somehow a small activity you can do on monthly basis. Okay, you try to check, is there any lumps or any unusual things showing in the breast. So this is for the earlier observations. Next, we can go to the next slide, Nero. Now let us see, these are greenwork products that can be used in conjunction with the cancer treatment. What does it mean? We suggest any patient that they have cancer, they should follow what doctors tell them to do. Maybe they have to do chemotherapy, or maybe they have to do radiation therapy. But in the meantime, we can tell them to take these products. So they take these products in the conjunction with the cancer treatment. So these are the products: Ganoderma Plus, and then Ginseng RHS, Cordyceps Plus capsule, and then Chitosan capsule. So these products, and including A Power. Okay, A Power is not only for HIV and AIDS. A Power also contain the Ganoderma, also contains sea buckthorn fruit, also contain some leaves that has a very powerful uh, substance to fight any cancer, So these products basically will support immune system, especially helpful to strengthen a weakened immune system after radiation therapy or chemotherapy. Yes, definitely after radiation therapy and chemotherapy, it will really disturb all the system, all the hormonal system, even it will destroy the white blood cells, uh, really disturbing the whole system. So definitely when the whole system get disturbed, your immune system is going down. uh, Basically, it's as simple like this. Okay, let me explain the a very simple way like this. We have a healthy body cells. Then when these body cells they get free radicals, like from the radiation or from chemical from the food we eat, which is contain a high toxin, insecticide, pesticide, chemical residue, or other cause which is causing the cancer, the healthy cells to become abnormal and then transform to become a cancer cell. So if anybody don't have a strong enough immune system, the immune system, the B lymphocyte cells, or we call it antibody, okay, antibody. So this, if this antibody, they cannot detect this is a cancer cell. They will still see or will still consider this is a healthy cell. Actually, this cell already transformed into cancer cell. So when the immune system is weakened, the problem is our immune system cannot identify this cancer is a cancer. So when we strengthen the immune system with the Ganoderma, with the ginseng, RHS, cordyceps, chitosan, okay, and then our immune system will getting stronger, and the immune system itself, it will identify the cancer cell as a cancer cell, the cancer cell, not as normal cells. So they will consider this cancer cell as an enemy, invaders. So when they notify this, the B lymphocyte will tell T lymphocyte or T cell. T cell is the soldier of the our immune system. So we'll tell the T cells to start destroying the cancer cell. So this is the idea. It doesn't mean Ganoderma will kill the cancer cell. It doesn't mean ginseng RHS will kill the cancer cell. No. What substance can kill the cancer cell? Chemical. That's why doctor is using chemotherapy. But herbal products, they cannot kill the cancer cell. What they do, they will increase, they will boost the immune system. So the immune system will be able to identify this is not a normal cells, and they will attack, they will kill, they will eliminate this cancer cell. This is the idea of using herbal products. By doing this kind of method, if we have a very strong immune system, there is no way a cancer cell can escape from our immune system. So totally it will vanish, it will be killed, it will be eliminated by our immune system. Not like doing surgery or radiotherapy, the cancer cell somehow still can hiding somewhere. Now let's go to the next slide. Now let us see here, we have nutritional support for cancer. So people who have cancer not only given by spirulina, Ganoderma, ginseng riches, or cordyceps, chitosan, but we also need to give them like blueberry super nutrition. Because blueberry super nutrition for people who have cancer, especially for those who already in the treatment from the doctor, either radiotherapy or chemotherapy, they have this terrible side effect. So we have to give them super nutrition This is to immediately replace the needs of nutrition to the body cells to rebuild the healthy cells. Okay, so our body need proteins to do the repair, to regenerate the healthy cells, to gain back the health, the uh, like to eliminate the side effect like vomiting or powerless or no energy, losing energy, and then the also, spirulina plus, it contains vitamin A, vitamin B complex, vitamin D, E, K, and then also a lot of minerals, okay, calcium, manganese, phosphorus, selenium, many other things inside, and also the essential GLA, gamma linolenic acid. So spirulina, the intention is like this. Spirulina is an alkaline food. Alkaline food. When we intake spirulina, it will start to alkalize your body. Cancer cell, not only cancer cell, bacteria, virus, and cancer cell, they are very happy when our body is acidic, when our body is in acidic state. Okay, so when our body is with the high acidity, this is the place where the cancer cell will grow very fast. The virus will enjoy their life in our body. So the treatment of using spirulina, the intention is to lowering down the body acidity. So when the body acidity is getting back to normal or more to alkaline state, then this cancer cell will feel this is not the place for me to grow. This is not the place for me to grow. This is not my environment to grow the alkaline body. And then we intake the Ganoderma, we intake the cordyceps, ginseng, RHS, strengthen the immune system. Then when the cancer is getting weakened, our immune system is getting stronger, then our immune system will easily attack or kill the cancer cell. Okay, so this is the idea. So basically, we need to add this nutritional support for cancer, like super nutrition, and then spirulina plus and compound marrow powder. Next, Marrow. Thank you. Okay, now these are the products to help you battle against the breast cancer. Breast care tea and breast care capsule. Okay, I think in Africa we only have breast care tea, but if you can communicate with your GM, it is also good to have a breast care capsule. Lagos already ordered some of this breast care capsule. We are still waiting for Nigeria, but hopefully in South Africa, or other countries, you can also start considering to bring this breast care capsule. Anyway, breast care capsule and breast care tea, it has the same ingredients, the same ingredients. The problem is only the one is in capsule, the other one is in a tea bag. So this is the difference of these two products. And then you can combine like with Ganoderma Plus, and then pudding plus tea, pine pollen tea. You can also add chitosan. You can also add spirulina. So we have the complete product series to fight the breast cancer actually. Okay, next. Now let's see the cervical cancer. So we can utilize this uterus cleansing pill, which is inserted to the vagina. And this uterus cleansing pill, it has a power to cleanse out all these problems from the uterus, from the even the cervix cancer. Actually, cervix is the entrance from the vagina entrance to the uterus. So cervix cancer is in the entrance of this between the vagina and the uterus. So by using uterus cleansing pill, it will help also to take care of this cervical cancer. And you can combine with other products like Ganoderma, Spirulina, Kudingplasti, okay, and other products. There are many package that you can add, many products, other products you can add into this cervical cancer. Then last one is prostate cancer. So now for prostate cancer, we have ProstaCare or ProstaSure. There are two names. One is ProstaCare, one is ProstaSure. It's the same thing actually. So ProstaCare or ProstaSure capsule is specially designed for the prostate problem, enlargement of the prostate, prostatitis, BPH, and then prostate cancer also. Then you have to take the beta carotene and lycopene capsule. This beta carotene and lycopene capsule is the essential nutrients for the prostate health, and then combined with kidney tonifying, and then Ganoderma Plus capsule. You can also add pine pollen tea. Okay, pine pollen tea. You can add chitosan. You can add ginseng RHS. Ginseng RHS is very strong, very powerful, which is it has actually ginseng. If we want to divide the active ingredients, is there are ginseng R1 and R2, RH1 and RH2. So RHS is the combination of these two, RH1 and RH2, which is make it more stronger to boost the immune system to and also has the function of antibacteria, antivirus, and it will definitely strengthen our immune system. So for men especially, please do not wait until you get this prostate cancer when you already get any sign that you have difficulties in urinating. So, or you feel trembling when you urinate, try to go to urologist, do the ultrasound scan to check the condition of your prostate. Is there any enlargement? Is there any tumor or cancer? So earlier observation is very good. So we can handle this problem earlier is much better and much more easier. So guys, okay, this is our today's training of cancer package. I think we have many questions, but we are going to answer this question later because now we are going to have another session from Madam Precious Nkomo, our leader from South Africa. The stage, I return back to Ms. Neronens Moyo. Thank you.